Federal Health Minister Jane Philpott is meeting with her provincial and territorial counterparts today in Toronto. The health ministers are unhappy with the Liberals' plan to slash the rate of increase on health transfer payments from 6% to 3% come this April. Earlier today, Philpott told CTV News she's looking for accountability over how healthcare dollars are spent.
We know that Canadians need better access to home care, they need better access to mental health care. We're really interested in those areas, and we're definitely letting the provinces and territories know that we want to see investments in health going to health.
CTV senior political correspondent Glen McGregor joins us now. Glen, thank you for being on the show.
Thanks, Beverly.
So tell me how much of a hot potato this is going to be, the rate of increase slashing from 6 to 3%.
Yeah, this is the big bone of contention going on in these meetings. You have 13 provincial and territorial health ministers in there trying to negotiate with one federal minister, Jane Philpott. And the big issue, of course, is money, how much of a rise they are going to get in 2017. This was supposed to be a fix for a generation when the health accord was signed back in 2004 under Paul Martin's government. The Harper Conservatives said they weren't going to keep paying those increases every year after 2017. And the Trudeau government says, okay, well, they're fine with that level of 3%. They say that they are getting tired of writing bigger and bigger blank checks with no kind of accountability from the provinces to prove that they're actually spending this money on health care. On the other side, though, the provincial health ministers coming into the meeting today saying they need that increase just to keep the lights on, to keep the healthcare system running the way it is and keep providing the same level of service they've been providing up to now, because population's getting older and healthcare costs are rising all over the place. So there seems to be a sense of resignation, though, amongst some of those provincial health ministers today that they are not going to get a deal today, and that it's ultimately going to take a meeting at a higher level, a first minister's meeting between the premiers and the prime minister in order to get that long-term increase committed to.
And I would think, and Glen, maybe you can tell me, because I'm not clear on this, but typically the federal government gives the provinces and territories their share of the health dollars, but that each province and territory is maybe not autonomous isn't the right word, but they decide how those dollars are spent. Accountability, it would seem, if there is going to be that, would have to be rewrite the laws.
Yeah, you're absolutely right. This is another point of contention between some of the provinces, although not all, and the federal government. The federal government wants to make sure that the money is being dedicated to areas that they think are going to get better results. Spending money on mental health, for example. They think that's going to ultimately lower the costs of the healthcare system, and also home care. The federal government is prepared to transfer $3 billion to fund home care programs in order to get people out of acute care in hospitals. They think that will ultimately save provincial governments money in the long term. But the provincial governments do not like the federal government telling it how it can or cannot spend its money on health care. Quebec in particular, very much opposed to having any federal strings attached to that funding. But Alberta says that they are willing to consider that and consider taking that money because they're going to spend it on, probably, Beverly, on home care anyway.
Okay, so a long day of meetings ahead, Glen. We'll let you get back to it. Thank you very much.